parole est à vous.
Senator Moncion, you have the floor. Thank you, Chair.
Information about the health care received. What we've heard, the same situation that you're explaining in Quebec, we've heard here in Ontario and other areas in Canada. Do you have statistics, data on the access or the problems of accessing these services from the English Quebecers?
We have recently submitted a brief to the Quebec government outlining what, in our opinion, are the specific challenges of the English-speaking community. These are now in their hands and are being studied as we speak in the context of preparing their next action plan for services to seniors in Quebec. We would be able to make that document available to you if you would like. We would be prepared to do that. What I can say is that the situation in terms of access is variable. It is more acute for the regions, in the regions, because we have smaller communities, and sometimes people forget that there are English speakers in every region of Quebec. There isn't a single region where there aren't English-speaking people. The other factor that is important to keep in mind from the point of view of seniors is that seniors who are English-speaking often find themselves in a restricted community in the sense that their children and grandchildren are oftentimes away from the towns and villages where they live and are not available as a first line of support when problems happen, when issues of health and disease strike them. Community groups in the area who support seniors, English-speaking community groups, are active in doing what they can, but again, they are under-resourced. So it is not unusual for somebody in the Gaspé having to go for medical services in Quebec City, and that is a day's journey, by airplane, or the train isn't there anymore. And sometimes to get from a village to a hospital center, you're looking at 100 kilometers, and if you don't have someone who's able to drive you, you can't get there. And one of the biggest impacts on seniors is their inability to drive. You reach a point where you can't drive yourself, and in that case, your isolation is almost complete. And as seniors age, they lose their support networks. They lose their friends, they lose their colleagues, and they become more and more isolated. And this is a real problem in many, many municipalities as the age of seniors is increasing over time. This problem is not a new problem that's been identified by the community. It's a problem that just recurs, and now it's become even more acute, and we seem not to be able to have the right conversation. The conversation that we have is with numbers and bureaucrats and statistics, and it's not a conversation that you have about values and the impact on human life. And that's a dimension that we brought in our opening statement. We think that we need to be able to talk to one another differently. We need to be able to reach one another as human beings. We need to be able to respect the precepts that we signed up to in the Declaration of Human Rights. We need to be able to support the orientations that look at health as a right to a human being. I know it's not a right in our Constitution, and I know that's a big step to take, but at least we can align our discourse, we can align the way we speak to one another in such a way that it respects the notion that people have a right, and it's not a service that is provided from on high to an individual. Every single human being should be able to have the same access in Quebec to the services that every single human being in Quebec pays for through their taxes. And the reality is we don't have that access. The reality is that there are people who suffer because there is no access to that. Our colleague mentioned that just a few minutes ago. There are people who suffer. There are people who do not have the services that their neighbor has, and that's just not right. And we need to be able to talk about that in a frank way and in a way that we listen to one another and we don't fall back on rules and regulations. Okay? We look at the impact of the rules on the human being. Justice Abella talked about this a few weeks ago in a statement or an interview that she had. Says, laws are just rules. It's the impact that they have on the human being that make them just or not. And there are injustices and indignities that people are suffering today as we sit here because of language barriers that are there that don't need to be there, that should not be there in our point of view. And there should not be a discussion around the politics of language when it comes to health services. This should not be something that is an obstacle. It's just not right.
Thank you. And I was going to ask the ear of the government, how open are they to changes, or how unopen are they to changes?
Sometimes I don't think that the babin follow what the butin don't suit the babin. You know, the people will say the right things when you talk to them, but when it comes down to seeing services on the ground, they're not there. There are always arguments and obstacles, and they set up barriers, and they move the goalposts, and they put in restrictions, and then it becomes something that is supposed to be done by someone else, and at the end of the day, things don't change, okay? It's Groundhog Day all over again. You know, this is the problem that we have. And we feel that unless we turn the page and do something different, the page is going to be blank, and we're going to go right back to Groundhog Day. Things don't change.
Thank you. Thank you. Oops, yes, Ms. Valiant, go ahead. Yes.
Yeah, I just wanted to quickly state that you're asking about statistics and data, and one of the things that we've been doing at the Black Community Resource Center is trying to collect race-based data, because as you know, I'm representing this community of linguistic minorities, but also a visible minority, and in Quebec, in the healthcare system, they do not collect race-based data. So we are working hard to be able to collect data on the experiences of the English-speaking Black community in particular. So we hope to have some statistics to just strengthen the case that we make here today.